Hi everyone, welcome back to TruthMed. I'm Dr. G, and today we are going to go over some scenarios where you can gauge your risk for whether or not you might possibly acquire, or more importantly, not acquire the COVID-19 virus. Okay, so the COVID-19 virus has been around for about 5 months or so now, and in some areas of the world it has just been awful, devastating. Think of places like New York and New Orleans and Seattle, Italy, Spain, some provinces in China, places like this. But in other areas it hasn't been nearly as bad, and some of the factors that have determined this are population density, for example, whether or not people can easily distance themselves from one another or not, and also whether social distancing policies had been in effect by the time the virus got there. But as things have cooled down in some areas, and particularly in the area that I live in, I've noticed some interesting sociologic and psychologic phenomena that have been occurring. For example, some people appropriately have been doing what has been asked of them by healthcare professionals and public officials. They've been distancing themselves, they've been using masks, these sorts of things. Other people have been refusing to go along with much of anything, and a small number of people haven't even been protesting those restrictions. Now, so far, there haven't really been a lot of surprises for me, one way or the other. In other words, I pretty much figured that there would be some people who are trying to be responsible and who are trying to do everything that they can to keep themselves and others safe. And those people think of the disease as being worse than the restrictions. But even though I may not agree with it, I can wrap my brain around the people who are, maybe the virus isn't very bad in their area, and they may have lost their job, and they're struggling with money right now, and they're struggling with the lack of the ability to be around the other people that they love. And so in those cases, people might think that the restrictions are worse than the disease. But regardless of whether you think they are right or wrong about that, personally I think they're wrong. But regardless of whether you think they're right or wrong, you can sort of wrap your brain around the logic. You can sort of see where they're coming from. But one of the things that I wasn't anticipating are the fairly large number of people who have been convinced by the media that setting foot outside their home for any reason is akin to a death wish. And I want you to know, if you're one of those people, I am not trying to make fun of you. I get it. This has been sort of a scary thing. And if you're not a healthcare professional or a first responder, you're probably not used to being in situations where there's a nasty bug involved that's contagious and that you could get, and that could potentially make you very sick or even kill you. Healthcare providers are a little more accustomed to that idea, at least. We've dealt with things like some of the worst flu years on record, that some of which have been relatively recent. For example, the avian flu or H1N1. We've dealt with things like tuberculosis, and in some areas of the world we've dealt with things like Ebola or hantavirus, things that are really pretty scary and had, in some cases, a much higher mortality rate. And if you're not used to that sort of thing, well, this is all pretty scary. But also there's the information to consider. There's been a lot of misinformation, and even at the best of times, the information has been mixed and in some cases contradictory. So you might be hearing some things that sound sort of reassuring, you might be hearing some things that sound overly positive and maybe a little hard to believe. You might be hearing some things that just sound awful and sound like it's just any day now this thing could come strike you down like the hand of God. Now, I personally have known a fair number of people who feel this way and who have been acting this way. In other words, people that basically just haven't left their home since March. And it's now May 25th, by the way. Or maybe they have left their homes, but only under dire circumstances and only with significant precautions to make sure that they are taking every possible precaution to keep themselves safe. And while this is certainly a very responsible thing to do, sometimes it may seem a little bit overblown, and some people have essentially gone into hibernation and have just been afraid for their lives, even under circumstances where maybe their risk isn't all that high. Now, if you've seen my video on the contagiousness of the COVID-19 virus, then you may have some idea about some of the factors that we're going to talk about today. And probably you've seen some of these things in other videos or elsewhere in the media or on the internet. But one of the things I've noticed is that just talking about how the virus can be transmitted doesn't always help everybody to really understand what their personal risk might be. In other words, what your personal risk might be. So today I thought we'd go over some very concrete scenarios, and we'll go over the factors that contribute to the risk or lack of risk, depending on the scenario, that might contribute to that situation, and what your overall risk would be, and what you should do to appropriately keep yourself safe in those situations, and maybe that would be a little bit more helpful. And remember, these guidelines are not just for COVID. This would work for the flu, this would work for the common cold, this would work for pretty much anything that is contagious. You can apply the same principles. So it's a useful thing to have in the back of your mind, even if you're not worried about COVID. Okay, but first, a few quick words about the different variables that can affect your risk level in a given situation. First, we'll talk about some fixed risk factors. In other words, these are things that don't really change from day to day. They're relatively stable or static. And your personal health history would be a good example of this. For example, if you're young, your risk is lower. If you are healthy, your risk is lower. However, if you have diabetes, your risk goes up. If you have heart or lung disease, your risk goes up. If you have a problem with your immune system, for example, HIV or AIDS or cancer, or you're on one of any of a number of medications that can affect your immune system, then your risk goes up. But that's a relatively fixed thing. It might change over years and decades, but it's not going to change much from day to day. Another fixed factor, one that is static and doesn't change much, is the virus itself. And what are the characteristics that we know of the COVID-19 virus? For example, is it contagious? Yes. Is it the most contagious virus that we know of? No, not by a long shot, but it is fairly contagious. Is it an enveloped virus? Yes. Is it an RNA virus? No. Is it a DNA virus? Yes. Is it exactly like the flu? No, though there are some similarities. Is it worse in the winter and better in the summer? Probably yes, although we won't know for sure until we can see what it does this summer. Is it spread through respiratory droplets? Yes. Is it spread through airborne methods or aerosols? Technically, yes, under certain situations, but that isn't its main method of spread, and it isn't a terribly good airborne spreader under most circumstances. Is it a contact spreader? Yes. Can it be spread through stool? Yes. Can it be spread through a handshake? Technically, yes, but not if you sanitize your hands afterward before you touch your face. What's the virus's favorite color? I'm thinking purple, but this is an area that really requires further study and research. Just seeing if you're paying attention. But now let's talk about some variable risk factors. In other words, things that will change from situation to situation. For example, the setting. What is the setting? Are you in a car with someone that you don't know very well? That's a very close personal space. There's not a lot of room there. You can't distance very well. Or are you in a very large building, say a Target or a Walmart or a grocery store, where there's a huge volume of air distribution and a good ventilation system? Or are you outside, where there's wind to disperse air molecules and there's UV light from the sun to help kill off viral particles in the air? So that's one factor that is variable. How about how crowded is it? If there are people packed in like sardines, like say in a movie theater or in a concert venue, although hopefully you're not going to many concerts at this point in time, but that would be a higher risk situation. Whereas if you're spread out, say you're in a park and there's nobody within 20 feet of you, that's a very low risk situation. How about, is there anyone who is obviously sick in your immediate environment? In other words, someone who is actively coughing and sneezing and doesn't look good. That's a bad situation. Or does everybody appear healthy? What about personal protective equipment? And if you haven't seen my video on that, take a look at that. But are people wearing, for example, masks? Are you wearing your mask? Are they wearing their masks? That will increase or decrease the risk depending on what people are doing. Another variable factor will be the amount of time that you spend with any given person or group of people. The longer you are around them, the more likely it is that you will be exposed to any particular contagious organism that they might have. So if you're just walking by someone, say in an aisle, or walking past someone in an alley, and you just very briefly go by each other, that's very, very low risk. But on the other hand, if you're standing with someone in a very close proximity for a long period of time, especially in a close environment, that is higher risk. And then another thing that is variable is the prevalence of the COVID-19 virus in your area. Now, pretty much anywhere you can now get on the internet or watch your local news, and you can get a sense for what the prevalence of the virus is in your area. In other words, how much of the virus is active in your area. If there is basically none, well then pretty much any situation is going to be lower risk. If there's a high percentage, let's say there's that 10% of the people in your area have COVID-19, that would be a very high percentage. That means 1 in every 10 people that you meet could have the COVID-19 virus. That is a higher risk situation. So these are some of the variables that can determine your risk. Okay, so now let's go over some specific scenarios, and in each scenario, we'll go over those variable risk factors. So in other words, setting, crowd, the prevalence, whether or not there is someone ill in the area, the time period that you will be exposed, and personal protective equipment such as masks, hand sanitation, this sort of thing. And then we'll finish up with a recommendation for how you can best keep yourself safe in that particular situation. Sound good? Okay, let's take the first scenario, which is your home. Now, this is kind of the obvious one. This is your sanctus sanctorum. This is your holiest of holies. This is the place where you can really let your guard down and relax. And as far as the space goes, it varies from place to place. Sometimes it's a cramped little apartment with lots of people. Sometimes it's a big house with not that many people. It varies. In terms of the time frame, it's long. You're going to be around those people an awful lot, your family or roommates or whatever. So that makes it higher risk. But the key here is, if there are any sick people, you're gonna know it. And if there are, you need to be more careful. But if there are not, then you don't need to worry so much. Now, it can happen. At the beginning of the COVID crisis, there were a lot of people in the hospital who were either sick with COVID-19 or we thought might be sick with COVID-19. And during those times, there was a lot of exposure risk for us. So when I went home during those times, I self-quarantined at home. We plastic sheeted off a room, the guest room and the spare bathroom, and I was the only person who went in those places, and that's where I slept and spent most of my time, which was really hard. I wanted to be with my family, but I couldn't really. And when I did come out, I was always wearing a mask. I wanted to keep my family safe, and I always kept some distance. No hugs for me for a couple of weeks while I was quarantining. And anything I touched we considered contaminated until it was cleaned. But it was necessary at that time because I was a high exposure risk. But most of the time you're going to know the people very well in your home, and you're going to know if they're high risk for exposure or not. And most of the time they're not, in which case you can let your guard down. That's a safe environment. No need to wear a mask there. Now, the next scenario is also a very low risk one. Let's think about hiking. Okay, you're outside, huge volume of air distribution, right? It's the great outdoors. And the wind is blowing viral particles away, and the sun's UV light is killing viral particles. There might be other people around, but you're probably going to have a big distance between you and them. And if you are around each other, it's usually just going to be in passing. So that's a very, very low risk scenario. Now again, people who are sick should stay home, but you wouldn't think you'd be out hiking if you felt terribly ill. So this is a low risk scenario. In this scenario, I would say maybe take a mask with you just in case you are going to be around people for any length of time. But most of the time you can leave that mask off. This is a great time to just enjoy nature, get some exercise, be healthy, particularly if you're with someone that, say a family member or someone that you know and you trust and you know that they haven't had any exposure risks. This is a good time to let your guard down as well. Maybe take your mask, but you don't necessarily have to wear it all the time. Next, we'll talk about stores like, say, a Target or a Walmart or a Kmart or a grocery store. Big, huge open stores, huge volume of air distribution, good ventilation systems. That's really good. And although they can be crowded sometimes, most places are limiting the number of people who can go in. And if it gets to be too high, they start forming a line outside. So it's probably not going to be too crowded. And you're most likely going to be able to spread out. You're going to have some distance between you. Even if you can see 50 people around you, if none of them are in your space, that's relatively low risk. And if you're wearing a mask and they're wearing their masks, that's also low risk. Again, if you're sick, stay home. If you see someone that is sick, give them space. You don't want to be around that. But assuming that's not the case, assuming you're sanitizing your hands, wearing a mask, that's a pretty low risk situation still. All right, now let's take in, right now it's sort of an imaginary scenario, but let's take a movie theater. I realize they're not open right now, so you don't really have to worry about that. But movie theater, now we're getting a little bit different. This is higher risk. It's still a big open space, but there's a big crowd now. People are packed in close to each other, and you're going to be sitting there with each other for a couple of hours. Now again, sick people stay home, and if there is someone who's sick, that risk just went up a whole bunch if there's somebody's really coughing or sneezing. But even if there is no one doing that, you're going to be close to those people for a while. This is a higher risk scenario. So right now, of course you wouldn't do it right now, but if you were going to do it, I would say all of a sudden a cloth mask might not be enough. You want to bump up to a surgical mask, or even better if you have access to one, an N95 mask, because all of a sudden it's looking higher risk. And of course, keep sanitizing those hands. Now, the big one in a lot of people's minds is work. And unfortunately, this is going to be variable. Maybe you work in a big open place that's not terribly crowded. Maybe you work in a small place and you work in a cubicle and you're only 4 feet apart from the person in the next cubicle. Now, in theory, your employer should be finding a way to give you more space, not having as many people at work at the same time so that you can spread out. But if that's not the case, or even if it is the case, you're probably going to be spending a long time around those people. So again, this gets a little higher risk. If someone is sick, send them home right away. No ifs, ands, or buts. We should have been doing this all the time, not just in the COVID era, right? But before, we kind of had this macho attitude, well, I'll come to work anyway because, you know, I'm a tough guy. We shouldn't have been doing that, and we certainly shouldn't be doing that now. If somebody's sick, send them home. But even if no one is sick, if it's fairly crowded, and if you only have a certain amount of distance and you're around those people for a long time, it could be higher risk. So if you're in a big open space that's not that crowded, cloth mask gonna be just fine. If you're in a place where you are kind of packed in and you're that way for a long time, in that scenario, if you can, you want to bump up. You want to go to a surgical mask, or even better, if you have access, an N95 mask. And honestly, you want to try to avoid that situation if you can. And again, always sanitize those hands. Okay, the last scenario that I want to talk about is the highest risk scenario. This is the worst one of them all, and that's in the hospital. So for those of us who work in the hospital, we have to be very, very careful because this is the highest risk scenario. The hospital itself might be big, but the patient rooms are small. And you might have 4 or 5 people in that room at any given time, a nurse, a doctor, a CNA, a respiratory therapist, and the patient. And we don't have the luxury of backing off because we need to examine that patient and we need to treat them. So we're kind of going to be right up in their grills sometimes. And we might be in there for a long time. And there definitely are going to be sick people because you wouldn't be in the hospital if you weren't sick. So this is the highest risk scenario, but that's also why we take the most precautions. N95 mask, face shield, gowns, gloves, and we are very careful about how we put them on and how we take them off. We're very careful not to track stuff from one room into another room. we have to be very, very careful because this is a very high-risk scenario. If you don't work in a hospital, stay away from the hospital, unless you happen to be the one who's terribly ill yourself, in which case I'm very sorry and I hope you get good care. But if you're not sick and you're not a healthcare worker, stay away from the hospital. That's a high-risk place. Well, that's about it, guys. Thank you so much for watching. I really appreciate it. I hope this has been of some use to you. If it has, please do me a favor and hit the like button or subscribe or share with your friends. I would really appreciate it. But in the meantime, stay safe out there, stay sane out there, and as always, remember, every day try to find a way to make the world a better place. I'll see you soon.